What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening. Hello, and welcome to today's episode of the Inflammation Investigator. Today, I am pleased to introduce you to Bonnie Ryckova. Bonnie is a posture and chronic joint back pain specialist who helps people with persistent joint or back pain understand and change the postural and movement patterns driving it, especially when physiotherapy hasn't worked. Her approach combines biomechanics, clinical Pilates, and insights from her own experience of chronic pain and hypermobility. Really, what I am interested to talk with Bonnie about today is the connection between inflammation and chronic back and other joint pain. So, Bonnie, welcome to the Inflammation Investigator.
Thank you so much for having me, and I am so happy to share a little bit more different, maybe insights on how our body's alignment can contribute to inflammation of the joints.
Fantastic. So, let's just start with a little bit about yourself. Tell us how you got into this and what you do in your practice.
So, as you mentioned, I actually got myself into this work by chance, I would say. I wasn't sporty. I wasn't really interested in anything to do with movement. I am economist, so I studied economics at university, and things were not really going the path I thought it will go in terms of my career. And I had this intuitive idea when I worked in the office for about 11 years that I want to do something different. And I had this nudge at the back of my mind that I want to become a Pilates teacher. I didn't know why. I didn't have Pilates experience. I went to one class which I absolutely loved because I loved the flow of the movement. I really loved the flow. And then when I look back into my childhood, I loved watching the flow of movement. I loved watching dancing, ice skating, figure ice skating. I loved even watching horse riding because of that nice fluid movement. And I didn't put any connections at all. I was like, it's just who I am. I love it. And when I was a child, I had few accidents, which were not really major accidents. However, what I didn't realize back then, my body started to change. And my body adapted to what happened in the past, to the trauma, to my body, and to the way my body basically aligned. So later on, when I studied at university, and actually in my teens, I had a little bit of aches and pains. Nothing major, pain in the ankle, pain in the knee. I couldn't ski because after one day of skiing, my knee was so swollen. I couldn't cycle. My knee got swollen. And yes, I was going kind of back and forward to doctors, orthopedics, and like, there's nothing wrong with you. Just, have a rest, put some ice on your knee and you'll be fine, like we usually maybe say to our children. And when I studied at university, I had more physiotherapy. And then back then I realized something is not really right. Something is not right with the way I am aligned. But again, I didn't have any formal education in terms of body or anatomy. So I just carried on with my life. And then when I grew up in Europe, I moved to London and I had another few accidents, very unfortunate. Um, but then these accidents really set me off to the path of what I'm doing now because I started to have more severe pain in my hip and low back area. I needed a little bit more physiotherapy and I tried chiropractor and tried different approaches. And when I started to study and deciding that I will leave office and I will become Pilates teacher, and I went through the kind of pathway of working in fitness first before studying Pilates because I didn't have any formal education in fitness. This is where I started to have more pain and aches and chronic pain because I was overtraining. So how I got myself into what I'm doing now was really changing my career, which got me into more fitness because I wasn't a sporty child. I was time to time going to the gym or doing some classes, but nothing really regular. But when I started to use my body in fitness training, maybe pushing a little bit harder, my body couldn't cope. And this was the time where I started to have more pain and more chronic pain, which I couldn't shift. I started to get into those flare-ups, which I realized they are coming quite regularly. At the beginning, it was time to time, nothing major, you can go through it, but then the patterns were more obvious and more obvious. And when I started to teach Pilates and when I became a Pilates teacher, I started to pay attention more because I had much better understanding of the body as such. I had better understanding of anatomy. And I find a really good therapist who were specialized in myofascial release techniques. And that was mind-blowing for me, because it wasn't anything like physiotherapy or chiropractic kind of adjustments. It was very different. And I had really good results and very deep results, very deep feelings and emotions actually, rather than just feeling physically okay. I felt emotionally different. And then I started to realize that all of it is really connected in the whole body. The emotions, the feelings, the trauma I stored in my body since I was a child, when I got through the first injury when I was 7, and then I had another injury when I was 10, and it was just piling up, compounding over the years in my life. And that was the time when I wasn't doing well physically, and I knew I had to do something. I decided to study further, and I became a rehabilitation Pilates teacher, and I've been doing it since then for 15 years. And in pandemic, I went a little bit deeper. We had a little bit more time in pandemic, so I started to study even more. And last year, I became a biomechanics specialist. So I went really, really deep into biomechanics, which is super interesting. And yeah, I got myself into the path of helping people who are suffering from persistent pain, which seem to not be able to shift with any treatments. basically a pain which is keeps coming back, flare-ups that are coming back, and people usually realize they they are in the cycle, and it is a cycle. And this is usually where people reach out because they realize they are in a cycle and they are looking for a little bit deeper, meaningful help.
There's so much in there that I want to follow up on. So I'm really excited for this conversation. One of the things I want to come back to in just a minute is myofascial release, because I think the fascia is very unrecognized when it comes to understanding how chronic inflammation works and why people have so many problems dealing with chronic pain because of that fascial release that we haven't really been taught about. But before we get there, I want to ask you how unresolved postural and movement patterns can quietly fuel inflammation over time. And let's go into the mechanical and the neurological explanations about how the body adapts to strain, compensation, and imbalance without us really even being aware of it.
And yeah, thank you for pointing this out because it's a little bit hidden because we wouldn't feel it because it's happening in over the time. It's a little by little, layer by layer, pattern by pattern, and usually we have layers and layers and layers of movement pattern and also postural patterns. But we don't realize that posture it's not static. We think about posture as standing or sitting tall. And when I say to people, when I introduce myself, people straighten up straight away. They feel like they need to be tall. And it's actually not about it at all. It's not about how you can sit tall or stand tall because it's almost forced posture, which creates rigidity and
Mm.
tension. You force your body into certain alignment rather than working on your body to be able to align. And this is a big difference. Forcing to be straight and working on your body to be able to give your joints and your spine the capacity to align certain way, which is two different things. So alignment or movement and postural patterns means that whatever happened in past to your body, and it could be very small fall, it could be something long time ago you forget on, you may not put one and one together, but your body started to adjust because your body was hurt, your body had to deal with that situation, whatever injury, no matter how small or big it was. And your body will deal with it because our body is very resilient. Our body is really capable of wonderful things, bad or good. So your body starts adjusting, adapting, so you can function, so you can go about your life. And these are those deeper layers. And then another thing happens, another layer, another thing, another layer. And then we find ourselves into the point where we feel either discomfort, we just don't feel right in our body, but we don't know exactly what it is, but we don't really pay attention. It becomes our new normal. But then we may get discomfort, which is a little bit of more nudge of this doesn't feel good, this feels tight, I can't really move the way I used to move. That's another layer. It's a sign of our body telling us, I really feel uncomfortable. Do something about it. But usually we go about our life and then we get pains and aches. And this is usually the time where we start paying a little bit more attention because it bothers us, it influences our life. It really is something which we feel like, okay, this is not good, maybe I should go see someone. And this is the time where people start a little bit paying attention, investigating, seeing physiotherapy, chiropractor, whatever practitioners they feel like it may help them. So the alignment, we get basically misaligned by developing these patterns over the time, could be decades. And then because our joints, but also bones get out of the place, out of the natural, or we call it neutral position, the best position, optimal position of our joints and bones, this this creates strain or pressure, uneven pressure on our structure. So if we think about our body as something which consists of bones and joints, and obviously then it's layers of the nervous system and the fascia and the muscles and so on, but that's on top of the joints and bones. So we create this uneven strain which creates the inflammation. That's from the perspective of biomechanics. Because we are moving, we are holding our posture, so it's a static and dynamic posture where there is an uneven pressure. So something is rubbing against something else, which creates the friction, which can create inflammation in tendons, in the joints, all around the joints. Could be bursitis in the hips, as people may know, could be inflamed tendon in a shoulder, could be all sorts of different things in different parts of the body. It could be even your toes. It could be even your big toe and your bunions. It's an inflammation because of the uneven pressure on your foot if your body is not aligned correctly. So this is from the perspective of posture and biomechanics, how inflammation can develop in the body.
That makes so much sense to me. I actually had a fall where I literally fell headfirst, tripped over something and went headfirst and landed right on my stomach. And I pulled a muscle deep inside my my lower belly, which I'm blanking on the name of right now, kind of embarrassingly. But it that was 2012, and I went to massage therapy and a lot of different things to try to release that muscle, but it wasn't until 2021 that I was able to finally release that muscle. And I noticed immediately how my posture changed and how I felt in my body, and all sorts of ways the inflammation was no longer focused in that area. It was such a relief. So I completely understand exactly what you're talking about. The body holds on to what your trauma is, especially if that's physical trauma. You might feel like you're moving on and moving forward, but it might still be lingering in there and causing deeper problems. So I want to talk a little bit about myofascial release because, again, that is something, well, I didn't know about it until I was in my, oh my gosh, 40s maybe, because it's not it's not massage, it's not chiropractor, it's not something that we were really taught about, that there are these things called fascia. Would you start off by explaining to us what is fascia and how does it hold on to the trauma in the body and the inflammation, and what happens if it's not released?
Okay, so I can talk about the fascia from what I know because I'm not expert at all on fascia, and from my experience, my own experience as well, what I experienced from treatments, but also from the perspective of fitness. So because my background, which I didn't mention, I did personal training first, then I was
Uh-huh.
studying Pilates, then I was studying rehabilitation Pilates, and then I was getting more specialty layers of how to work with body from the perspective of biomechanics and from the perspective of neuroscience as well, because I study the neuro perspective, how to approach posture, because it's all connected. So fascia, it's a connective tissue in the body. I can imagine fascia as a flow, or liquid which flows all around the body, because we have a front fascia at the front of the body, all the way down to our feet, and from the back of the body, let's say from your heels all the way up to the very top of your spine, your cervical spine. So I imagine personally as a liquid flowing in a little tubes in front of the body and at the back of the body. Now we have a superficial fascia which is underneath which is close to the muscles, but for me it's more interesting that the fascia is all around our organs as well. So it's connected to our skin, it connects to our organs, it's basically absolutely everywhere. So we can imagine this as a net, and the net has the little tubes with little liquids because it's absolutely everywhere inside us. And the thing is, with any trauma or tension, so if we imagine we are holding on to something, there's a big tension in our body. We usually feel it, many people have it, and to certain extent feel it at the back, so our back muscles. It could be any part of your back or the whole back, because we have a back fascia. So we may feel discomfort and little aches, which is coming back in our back. And what we don't realize, that over the time, because of that tension, we will hold the tension in our back fascia, which puts a little bit like a pressure on our muscles and the nervous system and the lymphatic system, because it's all connected. There are layers. The fascia, when it's restricted, or when the movement is restricted in our body, the fascia becomes restricted and it sort of dehydrates because there is no movement. Fascia needs flow and movement. And this is the interesting thing which I didn't realize. As I mentioned, I loved from the childhood flow. Watching dances, I was watching horse riding, and then later on I did also some dancing as well. Didn't mention I have medals in ballroom and Latin, so I love dancing. So fascia needs movement. When the movement is restricted, when our body is tense, the fascia gets restricted and dehydrates. There's less liquid flowing. And often massage therapists say that some people, when they massage people, they don't feel that flow. It's like they can't really grab on anything because everything is like stuck together. When I have a massage, the massage therapists always say it's so nice because everything flows in your body and we can massage even though I'm very thin. There's not much of fat to massage. There's not really putting the hands through tissue, but my skin is moving. It means everything is hydrated and the fascia is flowing. However, in the time where I was in my absolutely worst, but I felt like the pain is just going through my body. Like the pain was starting in my hip and then it went to the low back and then the middle back, and then I was so uncomfortable in my own body that I was really kind of desperate for any kind of relief because I just couldn't stand, especially my back, because it was just hurting everywhere. And I couldn't shift it, no matter how many stretches I did, no matter what, I couldn't shift it. And this was the time when I started myofascia. And the first treatment in a myofascia, because what I was experiencing in my body was the back fascia. And the myofascia I experienced with the therapist was something I can't really describe or compare to any other treatments, because it's not. The therapist is hardly touching you. The therapist usually keeps hands just above the skin. Sometimes the therapist may lightly touch you, but it's not going through the tissue. It's nothing like massage. It's nothing like someone will do osteopathy or adjustments. However, if you are more in tune with your body, at the beginning I wasn't because I was so tight in my back fascia, so I didn't feel anything. But later on, when I had the myofascia and I could feel my body, I felt like the therapist is moving tissue inside my body without touching me. And that was something very kind of very different from anything else I experienced, but it worked. So when I had the fascia release of my back, which is the very large fascia, I think it's the largest fascia, which is the back fascia. I had such a dramatic response. And now I know that it's better to go slowly with the treatment. It's not a good idea to have the first treatment, the biggest treatment, because we don't know how the body is going to react. We don't know, and the therapist can't know how much the body holds. It's not just the tension we feel in the muscles, it's the nervous system which is also compressed with the tension of these tissues, including fascia, including muscles, including everything else. So the tension is in the nervous system. So when I had the release, I completely crumbled. I had to go to work straight after. And I supposed to teach 2 classes back to back. And I wasn't able to teach. I wanted to cry. So my response was absolutely emotional. I felt very light in my body. I felt enormous relief, but the relief was in every single layer of my being. It wasn't just relief of the muscle. It was emotional relief, spiritual relief, but I was overwhelmed because I didn't know what is happening. I was overwhelmed with the amount of relief I felt, and what my body wanted to do is just rest. Just be, do nothing, and just rest. But I had 8 hours of work on a gym floor and teaching classes, so that wasn't really a good idea. So basically, I managed to teach 1 class and I had to go home after because I just wanted to cry and I just couldn't stop the tears. So for 1 hour, I was really doing my best so I don't cry in front of 20 people. And so I was holding really, really hard, but then I just couldn't. So I had to take day off. And basically, the only thing I wanted to do is do nothing and cry. So that was my experience with fascia. But I have to say that what many people think they have to do in order to relieve fascia, because this is what we know from fitness or maybe YouTube or social media, as it is presented on social media and online. People think that in order to relieve fascia, they have to roll it with the foam roller. They have to use tools, maybe facial tools like the gua sha, facial cupping. The thing is that the myofascial therapy actually is completely different from what the self-relief, fascial relief looks like in the fitness industry. And it does also feel different in the body. I tried gua sha, face cupping, I'm face yoga teacher as well, even though it's not my main um, stream of income or business, but I have the understanding. Um, it doesn't feel the same to the body because we should approach fascia in more gentle way. Fascia doesn't like go hard, roll your legs really deep on a foam roller. There are special tools, even softer foam rollers that has a little bit of give. People usually don't know about them. I personally do use softer foam rollers. There are other tools that are a little bit more gentle because fascia doesn't like to be pushed hard. Fascia again likes flow. For this reason, to restore the fascia into more flow, it's really restoring the movement of our joints and bones. So coming back to biomechanics, how it works is by releasing the restrictions in the body that are deep, by creating space around joints, meaning expanding the restricted areas, we are freeing up the fascia, we are freeing up the muscles, but also we are going to free up the nervous system because all of it is compressed, and this compression is very, very deep. So how biomechanics works is we are expanding, relieving this compression, we are decompressing our body so we can move. And when we can move, everything else will follow.
I have to say that I love your image of the fascia as flowing because I have always thought of fascia as more like a plastic wrap that is kind of around your organs and around your muscles, and that when it is warm, it's um, more able to give and expand, and when it cools down it might freeze up or harden in a way that holds everything in a restricted area. But you're right, fascia is a flowing, moving system, and I appreciate that visualization of it a lot better. I think it makes a lot more sense. So let's talk about what people can do to help release their fascia. And I know you have a simple practice that anybody can use to help reduce built up tension and pain and release that inflammation. Can you explain that to us?
So the first thing I do with people, so when I have a new client, what first we do very thorough assessment of how every single joint moves, and and posture as well because it goes together. So for people in generally having understanding of their own body, but also being aware of their own limitations and restrictions is super important. Because I always say you cannot change what you are not aware of. So having that sort of reference where, for example, I do posture audit, which everyone can book. If you have your posture audit, you will see yourself from different point of view because you will see yourself as a structure, and a structure which is mainly maybe in some places slightly, we can call it wonky or misaligned, but you will see it because we don't feel it. We don't feel it because it's our norm. This is how we feel on a daily basis, so we wouldn't feel difference. But when we see it, we have that point of reference, the visual, which gives us slightly different point of view, and then we start paying attention. So this is number one, feeling and really knowing yourself into a little bit more in depth. And then the second thing which I do is I will teach you how to breathe, but breathing in a way we use in biomechanics in order to expand the restricted areas of your rib cage. Because your rib cage is very large, and obviously we have the spine, so T-spine or thoracic spine, and very often the restrictions are either in front of our ribs or at the back of our ribs. Meaning, if the restrictions are at the back of the body, that will restrict the movement of your spine, but also it will restrict the movement of your shoulder blades, which will restrict the movement of your shoulders. So if there is a restriction somewhere around the ribcage area, it will affect the upper body, shoulders, neck, head and neck alignment, and it will affect the lower part, your lower back, your hips, your pelvis, down your legs. So starting with your rib cage and being able to breathe into your rib cage like breathing into balloon, which expands 360 degrees. However, not breathing into your neck or top of your chest, so you don't create actually tension, restriction, but expansion. It sounds easy, but it's not actually that easy as many people think. And then we think about the breath as, okay, I can breathe in because I am breathing in the whole life. Yes, breathing in may not be the issue, but how you breathe out in order to activate side abdominals might be an issue. So we are breathing in certain way into the base of our rib cage where we expand, but also we are breathing out in certain way where we are able to activate your side abdominals. You can think about them as a corset around the base of your rib cage, which will move your rib cage in line with your pelvis, meaning you'll be aligning your spine. And if you learn this way of breathing, you will also start moving your diaphragm, which might be stuck in one position. And that's another layer of compensation. And if your diaphragm is not moving smoothly with the in-breath and out-breath, your pelvic floor or your pelvic ball, we call it pelvic diaphragm, may not be also moving smoothly with the movement of the diaphragm up and down. They move together, and if they don't, we struggle with our core, with our abdominal muscles, which again have a ripple effect on alignment of the body and on restrictions in the pelvic area or anywhere else. And again, everything is connected, but we always start with the breathing to free up our not only thoracic spine, but everything else which is in our abdominal wall, all the organs. They also have to move. Our organs, they should be supported by our abdominal muscles and the fascia. So again, we are creating flow of movement inside the body, but also on the outside. So again, everything circles back to everything what we said today.
I think that we really have been raised in an environment of conventional Western medicine where everything is siloed, right? Oh, you have a pain if it's in your heart. Oh, you have a pain and it's in your wrist. Oh, you have a pain, it's in your hip. Oh, maybe you have a pain in your back. It's all happening in your back at that particular spot. But I think, and correct me if I'm not phrasing this correctly, but what you're saying is that it's all connected. And all of that pain, which is from inflammation, is all part of this whole of your body. And you have to pay attention to the whole vessel of your body. And release it all to deal with that chronic pain. Is that, am I putting words in your mouth, or is that what you would say?
It's correct. So yes, the problem is then if we go to see a practitioner and we say, my shoulder is hurting me, do something about it. This is what they do. They will look at your shoulder, they will try to do something about it. But this is exactly what you're asking for. So maybe phrasing it in a little bit in different way when we go and see someone, maybe asking for thorough assessment of the body would be better rather than asking for relief for a painful shoulder. So in my practice, I look at the whole body. I'm trying to understand the body rather than understanding pain. So yes, people come to me with pain. I get it. Pain is not nice and we want relief. However, first thing I am doing is I'm trying to understand my client's body. Why the body is giving you the pain, what the body is trying to tell you, what is happening. Once I get the picture through assessment, we start working with the body. We don't work with the pain. We don't work with what you think is good. We are working with the body as such in order to help the body to release the build up tension, to free up the space, to restore the flow where it's not. And this way, the outcome is actually in the full body rather than just in the place where we feel we need help. So it's a lot about educating, yes, because we don't learn this in school. We don't learn much about our anatomy, which I don't think is good. I think we should learn more about us and the anatomy, how it works, rather than just the superficial biology. And now I lost my train of thought, what I wanted to say next. Ah, um, yeah, but this is what I wanted to say. So basically, what I very often see and unfortunately very often disagree is sometimes people come to me and they say, I have a physiotherapy and I was given these 5 exercises. Are they good? I'm like, I don't know. Tell me a little bit more. Why you were given this exercise? What is the goal of this exercise? What is the goal, what you should be achieving with this exercise? Yes, the exercise is good, like there's nothing wrong with the exercise, but what we are achieving with these exercises. And people don't know. It's like, okay, you really should know what this exercise is going to do to you. Because if you don't know the purpose, it's very difficult to really help your body to make the change. So what I disagree is giving strengthening exercises far too early. So what we are trying to achieve with our body is alignment to take the strain from the joints to avoid the inflammation because we know inflammation is not good. So what we need to do is assess the whole body, restore the movement, so decompress the tight areas, restore the movement. And then we can gradually and in a very progressive way start loading the joints, which means strengthening with some weight. So the strengthening part actually comes later in the program or later in the plan. It's not the first thing we worry about. So people or very often come and say, I was given this exercise because I have weak core. Yes, you may have a weak core, I don't know. But why do you have weak core? Because your body cannot activate the core. Why your body can't activate the core? Because your body is misaligned. Your pelvis is off. your hips are off, the whole spine is off. Strengthening core first is not going to really help your body to align. So finding why the body is doing what the body is doing rather than straight away going into, I am weak, I need to strengthen. So we are not asking enough of why, in my opinion.
Well, I think that is a great summation as to really what we're talking about that inflammation in the body. So, Bonnie, where can people find you? Where's a good place to connect with you?
I am on social media on Facebook, Instagram, LinkedIn, and I have a website which is my full name, bonnieryckova.com. And also I offer free consultation or free posture audit. And in order to get your posture audit, it's absolutely necessary I see your body. So very often people book posture audit, but I cannot do without your seeing your body. And it's the best thing is to submit 4 photos of you from the front, both sides, left and right, and the back. And I have a look, basically your body's alignment. I analyze your body's alignment, and then we get on a call where I explain what I see, what I think is happening in your body, and I can point you out into the right direction so you are not wasting your time with endless appointments. So at least you know what to ask if you go to see any practitioner.
Excellent. So I'm going to ask you, would you spell your name so that people can really find you? And I will also put it in the show notes.
Yes, so my full name is Bonnie, which is Bonnie, followed straight away with my surname. If you are looking for my website, so it's one word, ryckova.com.
Fantastic. Bonnie, thank you so much for being with me today. And I think this is a very interesting episode, and people might be surprised as to how much inflammation the body might be holding on to without them even realizing that's what's going on. So I really appreciate you coming on. Thank you so much.
You are very welcome. I absolutely loved it and would love to connect.
Fantastic. Thank you. And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations. They work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.